Assalamu alaikum. Beta, in this video lecture, I will deliver the lecture on serous tumors of the ovary. Beta, a little quick recap to have better understanding later. I told you in the previous part of the video that the tumors which arise from surface epithelium of the ovary, the tumors which arise from the surface epithelium of the ovary, they include number one, serous tumor, mucinous tumor, endometrioid tumor, clear cell tumor, transitional tumor, and few more. But these are the really important tumors of the ovary which actually originates from surface epithelium. Okay, and out of all these tumors which are arising from the surface epithelium of the ovary, this is the one we have to discuss, beta. This serous tumor, it can be benign or borderline tumor or malignant tumor. I have given the detailed explanation of all these things in the previous part of the video. You can go and check it out. Benign, okay, it can be if it is having cyst like structure, so it will be called as cyst adenoma. Cyst adenoma. And if it is not having cystic structures but it is only having fibrous structure, then it is called fibroadenoma. Okay, and if it is having both cystic and fibrous structure, it is then called fibrocystic adenoma. I hope you are clear with this, beta. Okay, yeah. And similarly, serous tumors can be borderline or they can be very much severe malignant tumors. Okay, same is the story for the mucinous and all these. Like mucinous category, they also can be like cyst adenoma, they can be fibroadenoma, or they can be fibrocystic adenoma, depending on either they are completely cystic or they are having fibrous structure or they are having both fibrous and the cystic structure. Okay, so in this video lecture, beta, I'll deliver the serous tumors of the ovary. And don't forget, serous tumors of the ovary originate from the surface epithelium of the ovary. Okay, so if I start with the serous tumors of the ovary, you will see serous tumors make up 30% of all the ovarian tumors. Ovary के जितने भी tumors होते हैं, surface epithelial tumors हो गए, sex cord stromal tumors हो गए, जर्म सेल ट्यूमर्स होते हैं कुछ और मेटास्टेटिक होते हैं, उन सब में से these serous tumors which arise from the surface epithelium of the ovary, they make up 30%. Okay, and they make up 50% of the ovarian epithelial tumors. Okay, look, these all are the ovarian epithelial tumors. They arise from the surface epithelium of the ovary. Out of all these, only this serous variety make up 50%. Okay, and the rest all are 50%. I hope you are clear, beta. 50% of ovarian epithelial tumors. Okay, these all are the ovarian epithelial tumors and the serous variety makes up 50%. And furthermore, you will see, beta, that benign and borderline variety, they are up to 70% cases, and the malignant is not really common. It makes up 30% only, right? Okay, I hope you are clear, beta. I told you that the serous tumors, they can be benign, if you haven't forgotten. They can be benign, they can be borderline, they can be malignant. Okay, benign and borderline, they make up, they occur in 70% cases, and malignant occurs in 30% cases only, because it is very much severe condition. Okay, and what about the bilaterality? Bilaterality मतलब कितना परसेंट चांस है कि सीरस ट्यूमर्स जो हैं वो दोनों ओवरीज को बायलेटरली इन्वॉल्व करते हैं. जो बेटा बिनाइन ट्यूमर्स होते हैं, बिनाइन सीरस ट्यूमर, खास करके सीरस सिस्ट एडिनोमा, ये सीरस सिस्ट एडिनोमा एक बिनाइन सीरस ट्यूमर है, इफ़ आई एम नॉट रॉन्ग. ओके, सिस्ट एडिनोमा, serous cyst adenoma, it is a benign tumor of the ovary. Okay, and there are 20% chances of bilaterality in case of serous cyst adenoma, and 30% chances in case of borderline tumor, 60% chances in serous carcinoma. Okay, if I take you a little back here, what are the chances of benign tumor of the ovary, benign mucinous, benign, it is not the serous, okay, here. What are the chances of this benign serous surface epithelial tumor of the ovary to be bilateral? What did I told you, beta? 20%. Okay. And what about this variety? Borderline serous surface epithelial tumor of the ovary. It is how much chances that they are bilateral? In 30% cases, they are bilateral involving both the ovaries. Okay. And what about this malignant serous carcinoma or the surface epithelial tumor of the ovary? 60% cases they are bilateral. That means they involve both the ovaries. Okay. Right. Let's continue further. What about the pathogenesis? What is the pathogenesis of beta serous tumors of the ovary? Beta, don't forget, whenever I say serous tumor, it means it includes the benign, borderline, and the malignant variety all. Okay. In the pathogenesis, we will discuss the mutations which are involved. Okay, which lead to the development of the serous tumor, and what are the risk factors and what reduces the risk. Okay, so let's quickly see. If you'll have a look at the pathogenesis, beta, then you will come to know the involved mutations. The most common mutation is germline loss of function mutation in a tumor suppressor gene. BRCA1 and BRCA2, these two are the tumor suppressor genes which are lost in case of the serous variety of surface epithelial ovarian tumor. Okay, and few more things that I need to mention here, beta, that risk of ovarian cancer in women bearing BRCA1 BRCA2 mutations is 20 to 60% by the age of 70 years. अगर आप 70 ईयर ओल्ड वुमेन हो और आपके अंदर BRCA1 BRCA2 mutations हैं, so how much chances are there that you will develop the serous tumor of the ovary? There are 20 to 60% chances. Okay. However, the BRCA1 mutations are only present only in 5% patients younger than 70 years. Okay. This is very important point to understand that, beta, if you are 70-year-old, one condition is this, or it can be you are less than 70-year-old, like you can be 1 till 70. Okay, 1 till 69, let's suppose. You can be 1 till 69 or you can be 70-year-old. If you are 70-year-old and you are having BRCA1 BRCA2 gene mutation, then how many chances are there that you will develop the serous tumor of the ovary? There are 20 to 60% chances. Okay. And the beta, women who are in this age category, इनमें तो BRCA mutation खैर होती ही नहीं है, अगर होती भी है तो BRCA1 म्यूटेशन होती है, वो भी सिर्फ 5% केसेस में. ओके, BRCA1 म्यूटेशन इज प्रेजेंट ओनली इन 5% पेशेंट हु आर यंगर देन 70 years. I hope this is clear to you, beta. Other than BRCA mutations, some other mutations which are written here, let me show you. They include, now I'm talking about the malignant variety, serous carcinoma. बेटा एक बार मुझे दोबारा बोलना पड़ रहा है कि सीरस ट्यूमर जो है ये ओवरी के सरफेस एपिथेलियम से ओरिजिनेट होता है, ये बिनाइन भी हो सकता है, ये बॉर्डर लाइन भी हो सकता है, ये मेलिग्नेंट भी हो सकता है. ठीक है, और मेलिग्नेंट के अंदर भी इट कैन बी लो ग्रेड कार्सिनोमा और हाई ग्रेड कार्सिनोमा. ठीक है, यहाँ तक क्लियर है. जनरली कौन सी म्यूटेशंस मौजूद होती हैं? BRCA1 BRCA2. ठीक है, अब मैं खसूसन किसकी बात कर रहा हूँ? लो ग्रेड सीरस कार्सिनोमा की और हाई ग्रेड सीरस कार्सिनोमा की. इन केस ऑफ लो ग्रेड सीरस कार्सिनोमा द म्यूटेशंस विच आर प्रेजेंट आर in what genes? KRAS, BRAF or ERBB2 gene. These are the proto-oncogenes. And another mutation is present in the TP53 gene, that is a tumor suppressor gene. These three are your proto-oncogenes and this is the tumor suppressor gene. Okay, and what about the high grade serous carcinoma? The mutations are present in the PIK3CA gene and the retinoblastoma. Retinoblastoma is, by the way, this is a tumor suppressor gene and this PIK3CA is a proto-oncogene. Okay, so now you see what type of mutations are present in the low grade serous carcinoma and the high grade serous carcinoma. And one very important thing you need to note here, beta, almost all ovarian carcinoma, low grade, high grade, in women with BRCA1, BRCA2 mutation or high grade serous carcinoma. One thing that I have to make very much clear is that agar, okay, if a woman has BRCA1, BRCA2 gene mutation and he develops the malignant serous carcinoma, what variety of malignant serous carcinoma it will be? Low grade or high grade serous carcinoma? It will be high grade serous carcinoma. Beta, everything in this lecture is from your textbook Robbins Spaces, so don't miss it out, beta. Almost all the ovarian carcinoma in women with BRCA1 और BRCA2 mutations are high grade serous carcinoma. अगर BRCA1 BRCA2 mutations होती हैं बेटा और उससे जो कार्सिनोमा सीरस कार्सिनोमा डेवलप होगा, जो मेलिग्नेंट कंडीशन डेवलप होगी, इट विल बी हाई ग्रेड सीरस कार्सिनोमा. ओके, so in nutshell, serous carcinoma is the tumor of the ovary which originates from the surface epithelium of the ovary. It can be benign, it can be borderline, it can be malignant. Malignant जो carcinoma होता है, it can be low grade carcinoma, it can be high grade carcinoma. Okay, what type of mutations are present generally in the serous tumors of the ovary? Mostly BRCA1, BRCA2, and if let's suppose you have high grade carcinoma, then what type of mutations do you expect? What did I say? Almost all ovarian carcinoma in women with the BRCA1 BRCA2 mutations are high grade serous carcinoma. Okay, तो अगर आपको हाई ग्रेड सीरस कार्सिनोमा है तो डोंट थिंक अबाउट एनी अदर म्यूटेशन. इट इज़ 100% BRCA1 BRCA2 म्यूटेशन. ओके, सम अदर म्यूटेशंस इन द हाई ग्रेड सीरस कार्सिनोमा, दे कैन बी PIK3CA or the retinoblastoma, and some mutations in case of low grade carcinoma, they include mutation in the genes like KRAS, BRAF, ERBB2 or TP53. Okay, are you clear with this, beta? Are you clear with this? Yeah. Okay, what are the risk factor for the development of beta? What are the risk factor for the development of the serous carcinoma? What are the risk factor for the development of this malignant serous carcinoma? Whenever I say carcinoma, that means I am referring to the malignant serous condition. Okay, I am not referring to benign and borderline. What are the chances, beta? Nulliparity. The woman who has never conceived is the nulliparous woman. Family history of developing the serous carcinoma and some heritable mutations, okay, of BRCA1, BRCA2. And what reduces the risk of developing this serous carcinoma? The woman taking oral contraceptives. Obviously, oral contraceptives have their own demerits, but in terms, oral contraceptives can reduce the risk of developing the serous malignant carcinoma of the ovary. Okay, and the woman who has undergone tubal ligation, जिसने अपने fallopian tube को ligate close करवा दिया है, she is also at least risk. She is at least risk of developing serous malignant carcinoma of the ovary. Okay, yeah. From now onwards, beta, I'll deliver the morphology of the serous tumors of the ovary. But before I go to the serous tumors of the ovary, a little recap. Do you remember, beta, from the previous video that how does this low grade carcinoma develops? How does this low grade carcinoma develops? People first develop benign condition, any benign condition like cystadenoma, fibroadenoma, or fibrocystic adenoma, which then grows into borderline tumor. And borderline tumor then grows into low grade serous carcinoma, that is malignant condition. और हाई ग्रेड कार्सिनोमा क्या ऐसी रूट से डेवलप होता है? नहीं, हाई ग्रेड कार्सिनोमा ऐसी रूट से डेवलप नहीं होता. देन हाउ डज दिस हाई ग्रेड कार्सिनोमा डेवलप्स? This high grade carcinoma develops from completely different route, which I hope you have learned from the previous part of the video. कि क्या होता है बेटा, सबसे पहले मोस्टली जो आपका fallopian tube है, इस fallopian tube के अंदर एक प्रिकर्सर लेजन बनता है जिसको हम स्टिक कहते हैं, serous tubal intraepithelial carcinoma. This then develops into high grade carcinoma. So low grade carcinoma develops from this route. First benign tumor develops, benign serous tumor, which grows into borderline, and borderline then grows into low grade carcinoma. But when it comes to high grade carcinoma, it does not develop from this route, it develops from this route. Firstly fallopian tube के अंदर ये precursor लेजन बनता है और ये precursor लेजन डेवलप होता है ovary के इस high grade carcinoma, malignant carcinoma, serous carcinoma of the ovary. Okay, I hope you are now clear, beta. I'll now be talking about the morphology of the serous tumors, benign, borderline and the malignant. Beta, morphology of the serous tumors of the ovary, we will look on to the serous tumors of the ovary first grossly and then microscopically. Grossly, we will see the benign tumor, borderline and the malignant serous carcinoma, and microscopically we will see all these conditions, benign, borderline and this and the malignant one. Okay. Okay, beta, benign serous tumor of the ovary, how does it appear grossly? Grossly कैसा दिखता है क्या? benign serous tumor ovary का. ओके बेटा, ये सिस्टिक होता है और इसकी जो वॉल होती है बहुत स्मूथ होती है और ग्लॉसी होती है, ग्लिस्टनिंग होती है. ओके, जस्ट अ सेकेंड. या, द वॉल इज़ वेरी मच स्मूथ एंड very much glistening, and the surface epithelium of the tumor is not very much thick, and there are very small papillary projections. I'll show you each and everything. If you see into this picture, this is the tumor. Just a second. This is the tumor. Can you see beta? Can you see beta? This is the tumor. This entire is the tumor, and this entire is the tumor. And one very important thing, that the wall of this tumor is very much smooth and very much glossy. It is glistening and it is very much thin. You can't appreciate any epithelial thickening over here. Okay, you only appreciate that there is the smooth and the glistening surface. ओके, एंड वन लास्ट थिंग, दैट देर आर स्मॉल पेपिलरी प्रोजेक्शन. इसमें तो पेपिला होते ही नहीं है बाय द वे, लेकिन अगर होते भी हैं तो बहुत ये स्मॉल, देख रहे हो आप, पेपिलरी कुछ प्रोजेक्शंस होती हैं. ठीक है. एज कंपेयर टू दिस बिनाइन सीरस ट्यूमर, हाउ डज बॉर्डर लाइन सीरस ट्यूमर अपीयर ग्रॉसली? देर विल बी इंक्रीज नंबर ऑफ पेपिलरी प्रोजेक्शंस. ओके, यहाँ पे पेपिलरी प्रोजेक्शन बहुत कम है और इसमें पेपिलरी प्रोजेक्शन ज़्यादा होंगी और बहुत बिल्कुल एक पेपिलोम के जैसा दिखता है, इतना ज़्यादा इसमें पेपिलरी प्रोजेक्शंस होती हैं. यू कैन सी बेटा, दिस इज द कट सरफेस ऑफ द बॉर्डर लाइन सीरस ट्यूमर ऑफ द ओवरी. कैन यू सी? दिस इज कंप्लीटली लुकिंग लाइक अ पेपिलोम. कैन यू सी? देर आर सो मेनी स्मॉल पेपिलरी आउटग्रोथ्स, so many papillary outgrowths coming out, so many papillary outgrowths. It is not like the previous benign tumor. This is the borderline serous tumor of the ovary. Okay, and you can see from here as well, this at the top is your ovary. This is nice little beautiful ovary, and this at the bottom is complete borderline serous tumor. Just a second, borderline serous tumor. Okay, you can see there are so many papilla coming out, right? So increased number of papillary projections. And if you come to the malignant serous carcinoma, it is very much complex. There are large areas of solid or the papillary tumor mass. The malignant serous carcinoma is very much solid, and obviously इसके अंदर papillary growth होती है बहुत ज़्यादा बेटा. Can you see? This is very much hard, very much solid, and there is fixation. What do I mean by fixation? You can see this tumor. This is the malignant tumor of the ovary. This is the malignant serous tumor of the ovary. And what do I mean by fixation? It is very much fixed. It is very much fixed to the surface of the ovary. Okay. If this is, let's suppose, the malignant serous carcinoma, and this is the wall of the ovary. This is the wall of the ovary. You can see how much fixed it is with the capsule. Okay. Yeah. So it is fixed to the capsule. Capsule obviously of the tumor. कैप्सूल ऑफ द ट्यूमर, और उसके ऊपर ज़ाहिर ओवेरियन वॉल होगी. ठीक है. सो दिस इज़ द कैप्सूल. दिस इज आई थिंक आई मेड अ मिस्टेक, बट दिस इज़ द कैप्सूल ऑफ द ट्यूमर. दिस इज़ द कैप्सूल ऑफ द ट्यूमर, एंड अबव विच विल बी द ओवेरियन वॉल प्रोबेबली. सो दिस इज़ द malignant serous carcinoma. This is very much solid, okay, very much papillary, and it is fixed. It is fixed with the capsule of the tumor. Okay, right. This is all about beta the gross appearance of the serous tumor, benign, borderline and malignant. We'll now talk about the microscopic appearance. Microscopic appearance beta of the benign, borderline and the malignant serous tumors of the ovary. When I come to benign serous tumor, then what is written over here? That the cysts are lined. When you see under the microscope, you will see the cyst which develop in the benign obviously cyst adenoma, they are lined by the columnar epithelium having abundant cilia, and there are microscopic papilla may be found extending into the stroma. So I have to show you two things in the benign serous tumor under microscope. One thing is columnar epithelium with the cilia, and the papilla which are projecting are extending into the stroma. Okay, the benign and the borderline variety, they do not invade beta. The malignant variety which we will discuss, they have the potential to invade and metastasize. Okay, now if I restrict to this benign serous tumor, what will you see under microscope beta? What did I say? Columnar epithelium having cilia. Beta, this entire is the tumor. This entire is the tumor. Okay, just a second. This entire is the tumor, and this is the columnar epithelium. This is the columnar epithelium. Okay, I can't show you the cilia over here obviously because it's not possible here. This is the columnar epithelium with lots of cilia, with abundant cilia. Okay, and one more thing, can you see beta this tumor? This is the surrounding stroma. This is the surrounding stroma. This is the tumor. This is the lining epithelium of the tumor. Can you see this tumor is forming some little papilla, and its papilla is extending into the surrounding stroma. This is not the invasion or metastasis beta. This is not the invasion. This is simple papillary outgrowth of the epithelium. This is simple papillary outgrowth, okay, into the stroma. Okay, in borderline variety, what will you see? There will be increased complexity of the stromal papilla. इंक्रीज कॉम्प्लेक्सिटी ऑफ स्ट्रोमल पेपिला. जो पेपिला यहाँ पे थे, यहाँ पे उससे ज़्यादा कॉम्प्लेक्स पेपिला होंगे. और सबसे बड़ी बात यह कि बेटा जो कॉलमनार एपिथेलियम वहाँ थी, यहाँ पे भी वही कॉलमनार एपिथेलियम होगी, लेकिन देयर विल बी स्ट्रेटिफिकेशन ऑफ एपिथेलियम. व्हाट डज इट मीन? इट मीन बेटा नॉर्मली तो नॉर्मल अपीयरिंग एपिथेलियम ऐसी ही होती है, लेकिन स्ट्रेटिफिकेशन इज व्हेन देयर इज अ सेल अबव सेल, cell above cell. Okay, so this is a stratification which is seen in case of the serous borderline tumor. And in case of the serous borderline tumor, one more thing that you will see is the mild nuclear atypia. The cells of this serous borderline tumor, they are very much atypical at the nuclear level. These two things were absent in the benign serous tumor. In benign serous tumor, there will only columnar epithelium, no stratification. And in case of benign serous tumor, there were no nuclear atypia. And in case of serous borderline tumor, you see there is a stratification as well as mild nuclear atypia. Okay, and one very important thing, that in case of benign serous tumor, the papillary outgrowth was just simple. In case of serous borderline tumor, there is increased complexity of the stromal papilla. Okay. Few more things in case of serous borderline tumor, that the epithelial proliferation occurs in the delicate papillary pattern referred to as the micropapillary carcinoma. Now comes the very important point beta. Now comes very important point, that the serous borderline tumor में क्या होता है, जो ट्यूमर होता है उसमें से माइक्रोपेपिलरी ग्रोथ होती है, माइक्रोपेपिला बाहर आते हैं. और इस तरह के सीरस बॉर्डर लाइन ट्यूमर को, इस तरह के सीरस बॉर्डर लाइन ट्यूमर को हम क्या कहते हैं बेटा? माइक्रोपेपिलरी कार्सिनोमा. ओके, एंड इट हैज़ पोटेंशियल टू डेवलप इनटू malignant condition. What type of malignant condition will develop from this? High grade or low grade? If you can beta answer this question, all the hard work I have done from part 1 of the video to part 2 of the video will be paid off. If you can answer this question. What did I say? Just listen to the question once again. बेटा सीरस बॉर्डरलाइन ट्यूमर का एक वेरिएंट होता है जिसमें क्या होता है, जो पेपिलरी आउटग्रोथ्स होती है ना एपिथेलियम की, वो बहुत माइक्रो होती हैं. ओके, सो उसको हम फिर माइक्रोपेपिलरी कार्सिनोमा कहते हैं. ठीक है, and this is the micropapillary carcinoma which develops into malignant serous carcinoma. So firstly you develop benign condition, then you develop the borderline condition, a special variant of the borderline condition, this micropapillary carcinoma. And this micropapillary carcinoma, that is the special variant of the borderline tumor, it will develop into the malignant carcinoma. What type of malignant carcinoma? Low grade or high grade carcinoma? it will surely be low-grade serous carcinoma. Why? Because high-grade carcinoma does not develop from this route, benign to borderline, borderline to malignant. High-grade carcinoma develops from the completely different route. क्या प्रीकर्सर होता है बेटा हाई ग्रेड कार्सिनोमा का, जो कि कंप्लीटली डिफरेंट होता है? दैट इज ए स्टिक, एंड द स्टिक इज समथिंग दैट डेवलप्स इन द फलोपियन ट्यूब, हैज नथिंग टू डू विद दिस पाथवे. ओके, so I hope you are clear with this beta. Now we are done with the benign, the microscopy of the benign serous tumor and the borderline tumor. We'll now talk about the malignant condition. Okay beta, before I start with this, let me recap one thing very quickly. Beta, serous tumors which arise from the surface epithelium of the ovary, they can be benign. इनको हमने ग्रॉसली भी देख लिया और माइक्रोस्कोपिकली भी देख लिया. ठीक है. बॉर्डरलाइन ट्यूमर, इनको हमने ग्रॉसली भी देख लिया और माइक्रोस्कोपिकली भी देख लिया. उसके बाद आता है बेटा मैलिग्नेंट सीरस ट्यूमर. इसको हमने ग्रॉसली तो देख लिया, अब इसको माइक्रोस्कोपिकली देखने की बारी है. मैलिग्नेंट में से जो लो ग्रेड मैलिग्नेंट कार्सिनोमा है वो तो डेवलप होता है आपके इस बॉर्डर लाइन में से. ठीक है, पहले बेनाइन बनता है, बेनाइन से बॉर्डर लाइन से लो ग्रेड कार्सिनोमा मैलिग्नेंट. लेकिन जो हाई ग्रेड कार्सिनोमा है मैलिग्नेंट, वो इस रूट से डेवलप नहीं होता, उसका प्रीकर्सर को जो और होता है. या द प्रीकर्सर लेयन बेटा, द प्रीकर्सर लेयन ऑफ द हाई ग्रेड कार्सिनोमा इज स्टिक, दैट इज सीरस ट्यूबल इंट्रा एपिथेलियल कार्सिनोमा विच डेवलप्स इन द फलोपियन ट्यूब. ओके, and it is consisting of the cells which are very much identical to the high grade serous carcinoma. ये precursor लेयन है, इससे बनना है हाई ग्रेड सीरस कार्सिनोमा. ओके, और जो इसके अंदर सेल्स होते हैं दे आर वेरी मच रिजेंबलिंग टू दिस हाई ग्रेड सीरस कार्सिनोमा के सेल्स, बट दे टू आर डिस्टिंग्विश्ड बाय द लैक ऑफ द इन्वेजन. ऑब्वियसली जो प्रिकर्सर लेयन है स्टिक, इसके अंदर इन्वेजन और मेटास्टेसिस की पोटेंशियल नहीं होगी और इसके अंदर जाहिर है होगी. ठीक है. एंड फ्यू मोर थिंग अबाउट द हाई ग्रेड सीरस कार्सिनोमा, दैट द इंडिविजुअल ट्यूमर सेल्स ऑफ द हाई ग्रेड सीरस कार्सिनोमा दे शो सम न्यूक्लियर एटिपिया. The cells are pleomorphic and they have very high mitotic figures and there is multinucleation. The nuclei are multiple. Okay. So these all features are seen. These all features are seen in the individual tumor cell of the high grade carcinoma. One question that I'll surely repeat beta. What is the precursor lesion of high grade serous carcinoma? Is it borderline tumor? No. Borderline tumor is probably the precursor of low grade malignant serous carcinoma, but the precursor of the high grade serous carcinoma is this stick which develops in the fallopian tube. And I mentioned here that the cells in the stick are very much similar to the cells in the high grade carcinoma, but obviously the difference is of invasion. Stick, it doesn't shows invasion because it is a precursor lesion, and high grade carcinoma shows invasion and the metastasis because it is complete malignant condition. And these are the features which are seen in the cells of the high grade carcinoma. Okay, few more things about the high grade serous carcinoma beta, that the cells of the high grade serous carcinoma they are very much undifferentiated. इतने undifferentiated होते हैं कि इनकी serous variety ही recognize नहीं हो पाती, पता ही नहीं चलता कि if they are serous or not. Okay, and one very important thing beta, the related to the high grade serous carcinoma is presence of concentric calcifications. If this is the high grade serous carcinoma, then you will see some calcifications in the high grade serous carcinoma. These are called samoma bodies. Okay, these are characteristics of this tumor, but they are not specific because these samoma bodies are not only found in high grade serous carcinoma, but they are found in some other cancers in the other parts of the body as well. So it is characteristic but not specific. Okay, and beta high grade serous carcinoma, it has ability to spread to the peritoneum, omentum, and is associated with the ascites. Now beta, the serous carcinoma, as I mentioned, it can be the low grade carcinoma or it can be high grade. If I ask you the same question again, beta, from where this low grade carcinoma develops? It develops from the borderline. That was the micropapillary variety. But high grade serous carcinoma develops from stick. Okay, that is serous tubal intraepithelial carcinoma. Serous tubal intraepithelial carcinoma. The low-grade malignant condition, serous carcinoma, it spreads to the peritoneal surface, but it progresses very slowly, and patient may survive for long periods of the time. But in case of high-grade carcinoma, it widely metastasizes throughout the abdomen. It is not only restricted to the peritoneum. It can go to the liver and all other parts of the abdomen. It is very much widely metastatic. Okay, and patient may not survive. Right. Okay. A few more things beta here to be mentioned. That yeah, there are beta some serous tumors which we were obviously talking about. What did I say? The serous tumors arise from the surface of the ovary, as we discussed, as we have been discussing from the very first second of the video, that the serous tumors arise from the surface of the ovary. But don't forget, rarely they may arise from the peritoneal surface, and in that case they are called as a primary tumors, and in that case they are called primary peritoneal serous carcinoma. Again, from where do serous tumors arise? As per discussion we did, surface of the ovary. But rarely they can come from the peritoneal surface, arise not from the ovary but from the peritoneal surface. In that case they are called primary peritoneal serous carcinoma. Okay, in that case they are called not only the serous carcinoma but the primary peritoneal serous carcinoma. Okay, few more things to be added beta, that yeah, especially the borderline serous tumor, it may arise from or can extend to the peritoneal surface as the non-invasive implants. Okay, if I say, if let's suppose this is the ovary and the borderline serous tumor arises from the surface of the ovary, if let's suppose this is the peritoneum, so beta what happens, this borderline serous tumor which is present on the surface of the ovary, it can like extend to the peritoneum. And look, it was initially present on the surface of the ovary, but it is now present on the peritoneum. It is now present on the peritoneum, and this is actually called as non-invasive implant. तो बेटा जो extension हुई है इस borderline tumor की, borderline serous tumor की, from the surface of the ovary to the surface of the peritoneum, this nice little part which is extended from surface of the ovary to the peritoneal surface, this nice little part is called non-invasive implant, and they remain asymptomatic and they slowly spread, and if they get little larger they can compress the intestinal structures nearby. Okay, so they can produce the intestinal obstruction. Let's better talk about the very last thing, that is the 5-year survival rate. अगर आपका सीरस ट्यूमर चाहे वो benign हो, borderline हो, malignant हो, if it is confined to ovary surface, then the 5-year survival rate is 100% in case of borderline tumor, and in case of malignant tumor it is 70%. But अगर ओवरी के सरफेस से निकल के पेरिटोनियम को इन्वॉल्व कर चुका है ट्यूमर, तो 5-year सर्वाइवल रेट बॉर्डरलाइन के केस में 90% होगा, और ज़ाहिर मेलिग्नेंट के केस में उससे भी कम 25 होगा. तो बेटा अगर ओवरी की सरफेस पे मौजूद है ट्यूमर, तो ज़ाहिर 5-year सर्वाइवल रेट ज़्यादा है, और अगर ओवरी की सरफेस से निकल के पेरिटोनियम में चला गया है तो 5-year सर्वाइवल कम है. Okay, so beta, that's all about the serous tumors of the ovary. In the next part I'll continue with the mucinous tumors. Thank you so much beta. Class dismissed.